Hi everyone, welcome. My name is Laura and I wanted to hop on here because I've gotten this question a couple of times in terms of preparing for surgery and how to pack. And I definitely am usually an overpacker, but I basically took recommendations from a dozen different women and just packed all of the things. But I did want to share with you what I actually used. I'm not going to go ahead and go through all of the things that I did pack, like I may mention it, but I am going to focus on the important items that I did pack. So number one, underwear that clipped at the sides. So with my surgery, I had 360 liposuction around my entire legs, and for several days you keep your compression on, especially to prevent extreme swelling right away. And so a lot of people were recommending bikini bottoms. I personally bought some Skims Ability underwear. It just clipped. There were two little clips here. They were very comfortable. I still use them now, and they were a godsend. And that was just so I could change my underwear without having to take off my pants. But also bikini bottoms work for that. The second, probably most important thing that I packed is not a clothing item, but it was helpful for the first few days after surgery, and it is a Shiwi. And so this was to help me pee without getting any pee on my compression. And I personally got like a silicone one that's collapsible and then can go in a bag. Other people prefer one that is not collapsible. They said that they had problems with the silicone one, but that's going to be a personal preference. You just have to be careful, and you need to make sure that you make it to the washroom before it's like an emergency. And the thing is, with the compression, and you should be drinking lots of water, you should be peeing often. So this was very helpful for me with getting the compression down. Some people who might utilize customized compression, that compression can be even more difficult to get off. So it's a female urinal. I bought a Shiwi, was a godsend. Okay, then probably the third most important item was I just brought a bunch of cotton dresses that I could throw over my my compression without really having any extra weight or pressure on my legs. And this was helpful for me. I had my surgery the end of August, so I was in Poland for September, and the dress or a skirt was definitely appropriate. You do find yourself actually wearing the same things over because they're comfortable. I did also bring very lightweight sweatpants to just throw over my compression. I took probably several sweatshirts, but I would just take one next time. I wore running shoes there on the plane, but was also advised that if my feet swell up, it's helpful to have Crocs or some comfortable sandals. So I did take Crocs with me. I did wear them a little bit, but I was still able to wear my running shoes, no problem. So that was helpful. But just taking those two pairs of footwear should be good for you. Okay, what else was super important? Because of the surgery and your lymphatic system and stuff, I recommend just some comfortable sports bras, or even just tank tops that make you feel secure through your chest, rather than, packing a bunch of bras and stuff for your trip. Layered clothing, so like a sweater I could just throw on and take off, was helpful. And then I took pajamas, like pants and shirts, but ultimately I was most comfortable in just like a nightgown, which was just like a giant t-shirt, and I wore that for most of my trip in Poland. Okay, what are some other really important things to pack? Oh, dry shampoo. That was very helpful, especially because I didn't have a shower until day 7. I did wash my hair at one point, but just having the dry shampoo was helpful. Not necessary, but was very helpful for me. It made me feel fresh. I also had like washcloths and gave myself like a bird bath, so to speak. I'm trying to think of any other clothing that I would recommend. Ultimately, you don't need that much because after the surgery, you're healing and recovering. For me, I moved right away, same day. Once I had the catheter out and they had given me something to eat, then they let me get up and walk around, and I did squats same day. Just especially because I was on pain medication. The doctor was like, be mindful that you don't push yourself too far, but movement is really, really good. Especially it's going to get your lymphatic system working. It's also going to prevent any scar tissue buildup. Like if you don't utilize your knees and bend your knees and stuff right away, then sometimes that can create problems later on. I'm a yoga teacher, so I was very mindful that I wanted to be able to continue teaching. And so I did a lot of research. And so like previously, like years ago, like a decade ago, they would likely have you rest for a longer period of time, even after like a hip replacement. However, these days with the new research that they have you up same day moving because they know the benefits of moving and how being still can actually cause more problems than it is helpful. So it's like this delicate dance, this balance that you have to find after your surgery. Okay, so I'm gonna review the things that I believe are necessary. And then obviously your toiletries, toothbrush, floss, all that stuff is something I would encourage you to pack. But in relation to having your lipedema surgery, these are the things I think are the most important. So one, that underwear that can undo at the top so that you can take it off and feel fresh daily. So I took like 10 pairs because I wasn't sure if I'd be doing any laundry while I was there, although it was available to me right in the apartment that I rented. So next time I would take less because I would just do laundry because that feels good for me. The second most important thing would be that shiwi or the female urinal. Third most important thing would just be like a cotton dress that's comfortable and long. And then fourth most important thing would be shoes to wear in case you experience swelling through your feet. So like I said, I took running shoes as well as Crocs so that I would be comfortable. I took a lot more things, but those are the things I would recommend. I also took like some Nike flip-flops and some other shoes, but I found that I didn't really need those. And then a light pair of pants that you can pull over your compression, and then tank tops, comfortable tank tops rather than bras. Like I took it all. I think I even took like nice shoes for going out, and it was just a waste of packing. I could have put everything in a carry-on. However, I was also taking I took my pump that I use for my legs with me, and I'm very happy that I did. I did ask my surgeon if it was okay for me to start it, and she said about 2 days after it was okay, and I did, and I was just really gentle. I put it on one of the lighter settings, and it was very helpful. And those are the most important things. I will share some things that some people had recommended. I did also take puppy pads in case that I had any leaking. I had none. But I do know, depending on your surgeon and whether or not they leave your incisions open or closed, mine were stitched, then that can impact potential leaking. So some people ask your surgeon if they do typically stitch the incisions where they put the cannula. And if they don't, definitely take puppy pads to just light on the bed so you don't have to worry about the bed where you're staying. And then I also, because I was anticipating it, set them up on the couch and stuff when I was sitting just in case, but it turned out I didn't need them. So the ones that I used, I disposed of, and then I left the rest there, because typically a lot of women who are going for surgery might stay there, and then they would have been there if they needed them. Yeah, so those are the most crucial things. If I were to pick just 3 that were the most crucial, it would be the Shiwi, the underwear that's adaptable and you can undo it. And like I said, I ordered from Skims and they were amazing, but you could use bikini underwear that undoes there. And, okay, what would be the third most important thing? Probably just a cotton dress that's comfortable and long and free flowing, so nothing's really like touching or impacting your legs. Oh, and I would take sock slippers, just to keep your feet warm. And if you have difficulty with circulation to begin with, after you have the compression on and stuff, then you might benefit from having sock slippers there with you. I took mine because I packed everything, but those are the must-haves. Okay, I hope that was helpful. If you've also had lipedema surgery and traveled for it, and there's some things that you found incredibly valuable, put them in the comments so that we can share them with other women who are considering or preparing for surgery. And know that I'm excited for you if this is something that you're considering or about to embark on. I wish you all of the best, and please feel free to share your experience, share your wins, share any information you think would be helpful with other people who might be experiencing something similar to what you're experiencing, or maybe considering lipedema surgery. Okay, that's it. Bye, guys.